Hello, my name is Ariel Favela, and this presentation is on my project called Stronger Together, which is a response to the substance abuse crisis currently happening in the United States. This project was able to be done by working with the National Alliance of Mental Illness, or NAMI, which is the largest organization in the United States that helps individuals living and suffering with mental illness and their families. NAMI currently has a division in each of the 50 states. Specifically, the one I worked with was NAMI WCI, which specifically serves local communities in Tippecanoe County and the other counties found in West Central Indiana. NAMI is a nonprofit organization with the mission of advocating for, offering support, effective treatment, and education for individuals and their families that are affected by mental illness. The organization offers a variety of programs, both in person and virtual, to serve individuals suffering with these conditions. These programs are currently reaching out to over 2,000 individuals in the local communities of West Central Indiana. With the continual rise of mental illness and other comorbid diseases like substance abuse disorders, NAMI WCI is always looking to provide the best possible care and solutions to help the issues that these individuals and their families may face. By working with local partnerships like UI Health and other treatment facilities and even religious organization, these provide NAMI WCI a great form of outreach to seek and find individuals that could benefit from these type of treatments and programs. The rise of substance abuse disorders has been one of the biggest modern day public health crises in the United States. The Substance Abuse and Mental Health Services Administration estimates that nearly 16.5% of the entire U.S. population, or 46.3 million people, have been diagnosed in and have been living with a form of substance abuse disorders in 2021. While the national rates of substance abuse disorders have been declining over the past decade, the rates in Indiana are still above the national average in both alcohol and other substances like opioids. Moreover, the drug overdose rate for Indiana is at 43 per 100,000 people, placing it in the top 10 states in the country for drug overdoses. Peer led community interventions, like Stronger Together, are evidence based interventions that are proven to help people who suffer with substance abuse disorders or are living in recovery. Substance abuse disorders tend to be a chronic condition, and individuals living with these conditions require support throughout their lifetime while living in recovery or dealing with this condition. Groups like this can provide education on these conditions, provide resources for treatments in the local area, but along with that, they also give a sense of community by having the space to connect with other people who have shared experiences in dealing with substance abuse disorders. Recovery education has been shown to increase the level of community integration, knowledge, and attitude about recovery, and improves the quality of life of people living with substance abuse disorders and other mental health conditions. With there being a need in the West Central Indiana region to support individuals living with substance abuse disorders and in recovery, programs like Stronger Together can help these individuals find support and create community. The goals of this program are to provide education about substance abuse disorders, mental health, and how to live in recovery by empowering participants with the knowledge and resources that they need to stay in recovery and achieve overall physical and mental well-being. Another goal is to increase accessibility to recovery-based services in the West Central Indiana region, especially for those facing health disparities by not knowing or not being able to find services in their local area. Finally, the final goal of this program is to create community for participants by creating a safe space for individuals with substance abuse disorders to discuss the challenges of living with this condition and staying in recovery by having a space where they can speak and communicate and not be judged by others. Finally, the outcomes of this program in the short term is an increased knowledge of substance abuse disorders and living a life in recovery of 85% of participants. There will also be an improvement in overall physical and emotional well being of participants in the medium term goals. Finally, long term goals that will be seen in the West Central Indiana, will be a 33 to 50% reduction in the amount of relapses, um, and also a 33 to 50% reduction in the amount of substance abuse diagnoses given in Tippecanoe County. Currently, the proposed budget for Stronger Together is estimated at being at $17,749. With Stronger Together being a peer-led virtual group, we are able to save on significant cost of rent, materials, and even staffing needs, with the volunteer or intern taking the place of the peer lead. Currently, personnel that is only getting paid is the program director, and then the remainder of the budget is going to marketing materials for community outreach, as well as paying the Zoom membership for the year. The project timeline for Stronger Together will be run in 4 phases. The first phase will happen in the winter of 2023, which will be securing funds via grant and also through local stakeholders and partnerships that NAMI WCI currently has. Phase 2 will happen in the winter of 2024, and this will be setting up all the groundwork that is going to be needed to push Project Stronger Together. During this phase, it will be community outreach, connection with local partnerships, the push for marketing, curriculum and survey development, finding and training of the peer lead, and also finding and connecting with the local participants. Phase 3 will be the actual phase that will be for the actual program. This will be 3 months of weekly virtual meetings for participants, and this will also be when participants will be provided with initial and final surveys. In the final phase, phase 4, this will happen in the summer of 2024, and this will be done by the program director, and this is basically an evaluation of the surveys, an assessment of the program, and then a collection of all the data needed that will be presented to NAMI WCI's team. As just mentioned, during phase 4 is when the evaluation will be occurring of the program Stronger Together. Evaluations are very important as this is the only way to assess if the goals and outcomes of the program were met, along with helping the needs that were being sought out by the local participants. The evaluation will be completed by the program director with some assistance from the volunteer peer lead, especially during the time when they will be passing out initial and final surveys. Surveys will be both qualitative and quantitative in nature to allow for different metrics for comparative purposes and feedback for improvements. Surveys will be provided to be completed electronically by participants unless if they prefer paper charts, which can be mailed to them. This will happen prior to the program starting, at the end of the program, and then a 3-month post-program follow-up survey. This will allow for the program director to provide metrics to the NAMI WCI team and board of directors. This will also show the effectiveness of the program and in turn can show us how to improve future programs. Thank you all for taking the time to listen to my proposal for Stronger Together, which is a program that can drastically improve the quality of life of individuals living with and in recovery of substance abuse disorders in our local communities. Finally, I would like to give a special thanks to NAMI WCI CEO Sherry Moore for being an excellent resource and support throughout this experience.